Good morning to you. It's a Monday morning, and we talk this morning with Dr. Bryan Ardis, who joins us from Dallas, Texas, and we talk about an interesting topic. I think this is fascinating. A survey tells us that more than 20% of Gen Z healthcare workers, those are the youngest workers in the system, really, are thinking about leaving the industry. And our visit this morning is presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Dr. Ardis, good morning.
Good morning to you. How are you?
Wonderful, wonderful. And it's good to have you with us here today. You know, this is a really fascinating story for me because we might think that the reason that people are thinking of leaving what appears to be a really lucrative type of industry for them, a really good industry to be in, we might think it's because, job stress is something, burnout from all of the hours that you have to work. But they're not really saying that that is the reason for the most part. There's something even bigger than that, isn't there?
Yeah, they actually are reporting Generation Z members. In case the listeners don't know this, these are people born since 1997, generally, is that group. So you're talking about the youngest incoming group of individuals inside of healthcare, medical doctors, nurse practitioners, and physician's assistants. They are reporting that over 22% of them are going to be leaving healthcare in the next 3 years, actually by the end of 2026. And they report the number one reason is an unhealthy environment and the way that they are treated, meaning they aren't shown respect, which is very, very sad when you are referring to the industry called the healthcare industry having an unhealthy environment for them to exist. I find that an oxymoron and quite ironic, but this really does fall right in line with what we're hearing being reported around America, that even faith in all things healthcare in America, we're talking physicians, medically, and hospital systems. I don't know if you've seen these reports also, but there have been many, many health surveys of over 500,000 Americans. There has less than 40% of all Americans now have any faith in the American medical model, and that includes medical doctors and healthcare since the inception of COVID-19 in 2020. But before 2020, it was over 70% of all Americans had high amounts of faith and hope in the healthcare system. So there's just a lot of fallout from the COVID-19 pandemic, the hospital protocols that were ensued during the actual pandemic, and you're just seeing a massive fallout. And this is one of the saddest, in my opinion. The young people with a dream to serve others in healthcare are finding that they, in their own field, once they've now got the job they've always dreamed of, are now saying within a very short time frame, in the next 24 to 48 months, they're ready to walk away from that industry as a whole.
That is a scary thing because this is an industry that is already beleaguered, that they've been searching for people to work in this industry for quite some time, and the numbers are going down. So this is a real shortage, and something like this hurts because really it's self-inflicted, isn't it?
It is very much self-inflicted, and unfortunately the federal health agencies of our country didn't assist this either. And this is a very hot topic, obviously, even in the mainstream media, with the new president coming in January and RFK Jr.'s appointment as this chief secretary of the Department of Health and Human Services, and his mandate that's been given him by President Donald Trump to try to make Americans healthier again by reducing the overall burden of chronic illnesses, and then trying to restore some faith again in the healthcare systems of this country. And there's a couple things I'd like to share with the audiences that maybe they don't even have perspective on. Did you know that of all industrial nations in the world, I recently learned this, reviewing the data, I've done presentations to my own audiences. Did you know that America, all citizens 60 years old and older, so just picture your Medicare age group. Mm-hmm. Did you know there's no country that has over 35% of their senior citizens who are diagnosed with more than 3 chronic medical health conditions for life? There's only one country that has more than 35% of their senior citizens that have more than 3 medical conditions for life, and that is America. 42% of all of our seniors have 3 chronic illnesses inside the same country that has the highest paid healthcare system in the world. We spend more money on healthcare than anybody else. But one of the sad realities is not only do we spend more money on healthcare, we actually produce more drugs than any other country in the whole world. We consume over half of the drugs the entire world makes in this country, and this country only has almost 4% of the whole world's population. How is it possible America consumes almost 50% of all drugs worldwide when we have only 4% of the whole world's population? We are an overdrugged, overprescribed, and mistreated, it appears now, a group of citizens when it comes to our health. And you're seeing a massive fallout in the COVID-19 pandemic and how they handled the hospital protocols surrounding COVID and the vaccine agenda for COVID has created a massive issue inside the healthcare system and outside the healthcare system.
We have a tendency, therefore, to go searching for blame, and certainly there is a case to be made for finding out what is to blame or who is to blame for something like this happening. But my question has to do with why COVID-19 was such a turning point.
Yeah, everybody that's reporting it is COVID-19 that's created this massive distrust. In fact, I don't know if you've seen this, the Journal for American Medical Association in June of this year did a survey of all healthcare workers in America. And do you know that less than 40%, now this correlates exactly with what was being reported from the COVID-19 pandemic fallout of how it was handled. They're reporting that healthcare workers, all the medical doctors and all the nurses staff and all hospitals in America, less than 40% of them this year, in 2024, are getting the flu vaccines that are mandated to work in the hospital systems. And this is the first time ever because before COVID, it was 90% across the board were always up to date on their flu vaccines. And what they are reporting to the American Medical Association and to JAMA in these surveys is the COVID-19 vaccine agenda has replaced most of their faith in vaccines, and now they have doubts and questions about each of those medical strategies. Now, that's less than 40% for the flu shots, but what's even more alarming, they're reporting that less than 17% of all healthcare workers in this country are currently up to date on any COVID-19 booster vaccine. That's a horrific number when it comes to the healthcare system. So you can see these things do overlap. There is this issue reported by the healthcare workers in this country that they aren't having or showing as much faith in their own medicine, which is what they've particularly been promoting and taking advantage of, which is vaccine agendas seasonally every year for life to help with the flu shots, and now being told they need to be up to date on COVID-19 boosters. They're all refusing. And this really does stand on the foundation of doubt and confusion around medicine, mandates, protocols that they found themselves being forced to follow during COVID, the pandemic for the last 4 years, but not seeing the results. They did not see that the vaccine push prevented COVID outbreaks. They saw the opposite. They saw young people being diagnosed 5 times more often, particularly teenage boys, with a heart disease in 7 days after the COVID-19 vaccines. And the healthcare workers were responsible for trying to save the life of these kids. So for them, this is just one example of how it is they would be in the situation where they had firsthand look at what could be the problems with these forced EUA applications, emergency use authorizations, for the drugs in hospitals to treat COVID-19 patients that were never FDA approved before COVID, nor were they ever found safe and effective before COVID in human trials. These drugs were like remdesivir and midazolam, but these were forced on the medical professionals to use them during the state of an emergency, and they watched a high amount of these individuals. 33% of all of them experienced kidney failure in 48 hours, and that was a result of the drugs they were being forced to use. And that drug was called remdesivir. So as they watched that, and then watched the vaccine injuries and the lack of their efficacy to prevent a respiratory virus they called COVID, many of these people for several years now have been forced to use things, receive things to keep their jobs, only to find they didn't actually prove out to be as effective or as potent as they were actually marketed or propaganded. So yes, this really is a massive fallout from the COVID-19 debacle, and you're seeing it now even in the presidential race that was just forthcoming and just happened. You're seeing the fallout there too. So it's just very sad. What we want to make sure everybody understands, this is a big concern. It's not just for the citizens. The healthcare workers feel the exact same way. But the scary part is this Generation Z, they're wanting to leave. And if 1 in 4, which is 22% of them reporting they're leaving in the next year and a half, if they leave healthcare, did you know Generation Z is the largest group of people that is entering the workforce in all industries right now? In the next 3 years, they will make up 82 million people of the 300 million in America is this Generation Z. Well, if we're going to be a beacon of hope in healthcare as a country, you might want to have those people who are entering there have high hopes, high faith, and respect for the industry they're entering.
Dr. Bryan Ardis, our guest here this morning. It's interesting to me that that particular generation, the youngest of the people in the healthcare field, are the ones who say, I'm not going to be a part of this anymore. I'm going to move on and find something else. Where older workers who've been in the system for a while, they are more accepting of it. Why is that?
Yeah, the older generation is going to continue to have hope and faith in the industry they've invested so much time and energy in. What is ironic also is those who are retiring, which is the baby boomer ages, every year, the average retiring percentage of that age group is only 15%, but it's 22% are leaving of this younger 20 to 30 age group. Mm-hmm. And so this is just very telling, and I'm hoping that the healthcare profession as a whole will take a look at this younger generation who's coming in as their new golden children to take the healthcare system from where it is now far into the future, is to work and listen to them of what it is that's important to them. The reason why Generation Z is willing to walk off and why they claim their reasons are they don't feel respected at their workplace and their environment is unhealthy in their workplace. Just take a look at what they're reporting and then do your best to listen to them, because what they hold the most dear is an entrepreneurial spirit and a spirit of independence. This is what they want. They want autonomy, bodily autonomy, choice, freedom, which is what the entire country was founded on. And nothing was more challenging than the last 4 years when the majority of their medical freedoms were challenged, even in their ability to practice medicine. That's the whole thing, right? We've heard it our whole life. You have the freedom to practice medicine, and what that means is you as an individual get to take your clinical experience, your knowledge and education, and work with a person one-on-one to help guide them back to health, no matter what it takes. But you have to learn from them what medications, what detoxing protocols, what dietary changes are working or not working for them, and what is their medical history. They want to be left alone to be able to practice truly medicine the way that they see it. And they respect individuals' autonomy. The choices that they make are their own, and they can't be forced to do something else or punished or judged as a result of their choices. But that is what is truly being found and heard and seen by them, Generation Z, workers in the healthcare force. They are seeing those rights are being taken away from their patients, and that they themselves weren't giving true autonomy and independence to make their own choices over the last 4 years. The last 4 years is an accumulation, by the way, of already things that were disgusting, disappointing in the healthcare system leading up to the pandemic. It just made it a whole lot worse.
He is Dr. Bryan Ardis. He's the author of the book, Moving Beyond the COVID-19 Lies, Restoring Health and Hope for Humanity. I want to thank you for joining us today. It's been eye-opening.
Thank you for having us, and I want to wish everybody a happy new year. And just remember, your health care is really determined by your own choices. So make better choices in food, diet, exercise, moving. Move your booty. The more you move, the better your life is. God bless you.
I'm going to move my booty on out of here. Thank you, Doc. It's the voice of Indiana County, WCCS, 101.1 FM, AM 1160, and WCCSradio.com. Fox News next at the top of the hour, and then it's the Brian Kilmeade Show.